my subdermal implant. Hello?
Implant. Wait there.
Blaze, it's me. It's me, Blaze. Sorry. He does not like when I make that voice. Hi there, welcome to my channel, Bingo It's Kimbo. I'm Kim, also known as Dr. Goodall to some, and this is a safe place to learn about and celebrate being a woman. If you haven't already, just go ahead and click that subscribe button to join the Bingo Baby family. Every Wednesday we talk about reproductive health. So this week, we are continuing the Girls Chat Birth Control Edition. Last week was part 1 where we spoke about the scheduled methods such as the oral contraceptive pill and the depo provera shot. That did not come out right. The depo provera shot, there we go. Also known as depo, the injection, the BC shot, right? So this week now we're going to talk about the low maintenance, long-term yet reversible methods, which include the subdermal implant and the intrauterine contraceptive device, also known as the IUD or the IUCD. So if you're interested in learning about those two methods, keep on watching. So low maintenance birth control methods are also known as the get it and forget it methods. Why? Because after getting it, you don't have to do anything else to prevent pregnancy. However, as emphasized in part 1, there's only two methods that can prevent STDs. That includes condom usage and abstinence. So if you aren't applying any one of those two methods to your sexual relations, there is a risk of contracting sexually transmitted infection. And I mean, I covered those and what's normal and what's abnormal when it comes to discharges and the vagina in my Vagina Demystified series. So if you really want to know, you know your girl got you, because here's what. No more being in the dark about the reproductive system. Like, if it's up to me, everything I'm gonna cover. I'm gonna shine the lights on everything, nothing I miss. So, if you want to know about it, just check out that video. Anyway, I digress. Alrighty, first up is the subdermal implant. This is a thin rod about the size of a matchstick, and it releases the hormone progestin, which prevents pregnancy by thickening the mucus of the cervix, acting as a sticky guard against sperm. And if there are any determined sperm that get past this sticky first barrier, it also prevents ovulation, which is the release of an egg or ova from the ovary. So there's no egg to be fertilized. So it's like a double whammy. And it continually does this over the span of 3 to 5 years when you have the implant in. Now, when you remove the implant, it is reversible and your fertility returns. So if you do remove it, know that you have to initiate a different type of birth control if you still desire to have contraception. How is it put in? Now your girl gonna show you, okay? Doctor, teach me. All right, baby, I'll teach you. Come, ready? It's inserted in the upper arm, right? About here, so more or less, right? And before it is put in, you take the needle with the numbing agent. It's gonna feel like a little pinch, right? And you put it around the area of insertion. Now, I don't have the insertion device, but I can just show you basically what happened. The rod is in the insertion device and it just slips right under the skin and it sits there for 3 to 5 years, releasing the progestin and preventing pregnancy. Now, removal is pretty simple. You numb the area, you make a little small, tiny, very tiny incision after numbing the area, so you shouldn't feel it at all. Any of this you really should not be feeling, right? And you take a device to pull out the 2 rods. Now, some brands have 1 rod, some brands have 2 rods. The subdermal implant is effective immediately once you insert it within the first 5 days of your menstrual period. If it's inserted any other time of the month, you must wait 1 week before the contraceptive effect of this method kicks in. In other words, use protection. So let's talk health benefits. The number one health benefit of this form of birth control includes the minimizing of menstrual cramps and PMS, premenstrual syndrome. Now, if you have cramps, honey, this particular option is a pretty good option for you. This method is also great for women who can't take estrogen, such as persons with seizure disorders, with clotting disorders, hypertension, and endometriosis, just to name a few. This option is really great for persons who suffer with cramps overall, as I mentioned. So as you know, endometriosis, ladies, you can check this option out. Also, there is a video on my channel about endometriosis, so you can just, check that out when this one is done. Let's discuss side effects. Like with every medication, there are side effects, and we're going to talk about the immediate and the longer term side effects of this medication. First thing, immediately, you may have bruising or discomfort at the site of insertion. So when the numbing agent wears off, you may feel a little teeny bit of discomfort that an over-the-counter pain medication can handle, like ibuprofen. Now, there's also a risk of infection if you don't care for the area properly after insertion. So make sure you keep the area dry for 3 to 7 days. Ensure that it's appropriately cared for. Heals up in a week's time and you're good to go. Longer term side effects include spotting. Now, some women experience spotting within the first 3 months of the insertion of the subdermal implant. Spotting is just breakthrough bleeding in between periods. Over time, you will see lighter periods, and if any period at all, actually, because the progestin will minimize the amount of periods until it completely just goes away while you have in the implant. And when you remove it, as I mentioned before, everything goes back to normal. Now, another side effect that some persons experience are PMS. Now, of course, it can help with PMS symptoms, but for some women, especially in the first 3 months, there's a bit of changes that occur with the period. Rarely, but it can happen. That includes mood swings, cravings, and even changes in the amount of bleeding and how long you bleed for. After 3 months, everything should really settle down. But if you have excessive cramping or nausea or dizziness, then you go back to your healthcare provider and let them know, because this form of contraception is just not for you. And there's something for everyone. Something that may work perfectly fine in one woman may not work well in another woman. In fact, I would love for you guys to just comment below if you've ever tried the subdermal implant and just share your experience, so when other women come and see the comments, they can have an idea in addition to what I'm saying. Because remember, this is a community and we're learning and celebrating being a woman. This form of contraception lasts up to 3 to 5 years. So yes, girl, you put it in and you don't have to even think about baby for that period of time until you change it or you remove it, right? Because remember, again, I keep on emphasizing this because it's a myth that once you get the subdermal or the IUD, you can't have babies. That's not true. One of the side effects or the complications do not include infertility. All right, so let's just clear the air. All right, now the dust settled, we can continue. Periods, they can cease. And remember, I said that is normal because there's no ovulation, then there's no reason for you to have menstruation. And if you want to understand menstruation, you can check out the video. But yeah, there's no period for most women who have this method, which is a special consideration. I mean, having a little break, especially for women who suffer with endometriosis, dysmenorrhea or menorrhagia, or any other complications with the menstrual cycle, this is a great option for you. It's pretty private, is another consideration. Nobody now gonna know, say, a rod right here. So it's under the skin and you can feel it. You're supposed to feel it when you press down in the area. However, when you look on it, it will look just like this. Something that persons are really concerned about is if it will tear through the skin and break through. As you saw with the illustration, the rod is not a firm rod, it's very bendable, which enables it to be less likely to rip through any tissue. It's not doing no ripping through, so there's nothing to worry about. Okay, time to talk about the intrauterine contraceptive device, also known as the IUCD or IUD. And the name just explains exactly what it is. It's a device that goes inside of the uterus. Of course, I have one here for you. It's a T-shaped device that is made of either plastic with hormones or copper. Alright, so the hormonal IUD. Now this IUD is pretty much the same thing as a copper. Same shape, same insertion, same use, except for the fact that the hormonal IUD has hormones. So if you want an option without hormones, a copper IUD is the best option for our ladies who don't want to ingest any or take in any hormones. Now, the hormonal IUD, unlike the copper, cannot be used for emergency contraception. So if it's a case where you're looking for emergency contraception and you miss the 72-hour mark with the pill, you can still get the copper IUD. Now, the hormones used in the hormonal IUDs are levonorgestrel, which is just a form of progestin, which is the hormone we've been talking about throughout this video and last week's video as well. So how you put it in, doctor? How you put it in? How you put it in, girl? You know, I got you. I have the whole set. Like, I ain't playing with you guys. Nobody not gonna be afraid of getting no IUD if it's up to me. There's no mystery. There's no need for no mystery. But before we get into the demonstration, there are 3 things you must know. First thing, you must go to your doctor and get it. They must take a history from you. They need to know and understand your risk factors, because there are certain things that prevent you from being able to get an IUD. This includes cervical cancer or untreated cancers of the uterus, history of pelvic inflammatory disease, which was discussed in the STD video, so you can check that out. Possibility of pregnancy, that is something that definitely has to be ruled out, or any abnormalities of the uterus, because there's not just one type of uterus, there are different types, there are shapes, and it's important to know, which leads me to the next thing that is needed before getting an IUD, which is an ultrasound. An ultrasound is so important because it enables your healthcare provider to know what type of uterus you have, the size, if you're pregnant or not, and essentially just visualizing what we're about to insert something blindly into, because it's a blind procedure, which means that we can't directly see exactly where we're going. However, with measurements and with experience, you can insert the device in safely. The third thing that is very important to know before getting an IUD is that you need a recent STD panel, because if you have an STD, right, let me show you, and it's in the vaginal canal right here. If you insert anything into the uterus, you're exposing the sterile uterus to the unsterile vagina. And if there's an infection, you just transfer the infection into the uterus, which can result in pelvic inflammatory disease, which again we discussed in another video. So if you want to know what that is, how that affects you, you can check that video out. Now we reach the part where everybody wants. No one, so come, gather along. You go to your doctor's office without any fear or concern. You watch this video, you know exactly what will happen, right? And you go into the same position that you would be in when you get to a pap smear or a vaginal examination. So it's the same kind of procedure. Then the speculum, that silver thing that they use to put inside of the vagina. Yes, the speculum, I'll show you a picture. Look at the picture, yeah. That thing. They put it inside of the vaginal canal and they open up to see the cervix. Your doctor will measure the length from the cervix to the top of the uterus here. And this device will go through the vagina, through the cervix, right here to the place where they measure. So let's say they measured 5, Then you literally push in and pull out, and then the T shape will pop up and go into place in the uterus. You see that? So it stays in place right inside of the uterus, right there. And then there's strings that hang, and the doctor would snip those strings just long enough to be able to feel them, because it's important that you feel them after you put them in, and check for them after you put it in, because you don't want to lose those strings. If you can't find those strings, you need to go back to your doctor so you can find the IUD, because it can either drop out or it could be dislodged or moved or relocated somewhere, which is not a good thing, right? So it's very important to note that, all right? So you cut the strings here, and then the strings will remain, and you can feel them with your finger. Now, a lot of people are concerned, can I feel the strings when I walk around or if I engage with sex? Some persons say that their partner can feel the strings when they try to, but typically on a day-to-day basis, you don't feel the strings. It's as if it's not there. So let's talk health benefits. We already discussed this just a little bit when it comes to the hormonal contraceptive or hormonal IUD, where this is a great option for women who suffer with endometriosis or really awful period cramps or heavy bleeding. This contraceptive method helps to regulate the reproductive system in a way where the periods are lighter or non-existent, preventing the pain that comes with the period because there is no period. So this is a great option for women who really want to break from their period, want contraception, suffer with endometriosis, or simply just don't want to have a period. Like, you just don't want to have a period. All right, let's talk about side effects. Number one, cramping on insertion. Now, especially for women who've never had children before, your uterus never have nothing in there yet. So if you introduce something in there, the uterus is just like, you know, what's that?
Excuse me?
What? So cramping is expected. So a lot of the times doctors actually advise patients to bring an ibuprofen to take prior to the procedure, just to minimize the discomfort that occurs with the insertion process. Cramping can last up to a month or two when your body's trying to get used to it, but if it's longer than 3 months and it's unbearable, I advise you to go back to your healthcare provider, because contraception is not supposed to be painful. It's not supposed to take away from your life, you know? So if that's happening to you, or you have excessive bleeding, you may want to reconsider a different form of birth control. Another side effect is spotting in between periods, and spotting after insertion is normal. However, if you experience heavy bleeding and cramping and significant pain after insertion of the IUD, I urge you to go to your healthcare provider, because they want to see if there's any complications such as perforation. Now, copper IUD have similar side effects. However, an additional side effect includes really heavy bleeding. So some women experience extremely heavy bleeding, heavy bleeding with copper IUDs, which is an indication that you may want to remove this birth control option. Another side effect of the copper IUD, in contrast to the hormonal IUD, is that the copper IUD has a history of worsening menstrual cramps. So if you're someone who already has pretty bad menstrual cramps, the copper IUD is not an option for you. However, the Mirena or the hormonal IUD is definitely an option, because the hormonal affects the severity of your menses and the copper doesn't. It can worsen it. Okay, so those are another set of differences that occur between the copper IUD and the Mirena. And these are things that can happen. For some women, it's perfectly fine. They don't have any experience of any of the things that I mentioned. For some women, these are the symptoms that they experience. So again, if you have any additional experiences, you just go ahead and comment below, because again, this is a community. And that, family, brings me to the end of this week's video. I really hope that you found this informative and helpful, guys. I'm so happy to be back. Like, I love this. Like, I love, you know, coming on here and educating and being myself. It's really nice. It's refreshing, and I'm just excited to continue to grow with you guys. Don't forget to like, comment, share, subscribe, the works. Tell your auntie, your granny, your sister, your cousin, your brother, your partner, whoever, to check me out, because we're growing and I love it. I hope you have a beautiful day, and I will see you guys next week with another video. Shalom.